Hello, how are you doing? Good evening, and I trust you're well. So today we are being joined by Ba from Cameroon, and he's going to share about the COVID-19 situation as it is at the moment in Cameroon. So let me bring Ba on board so that he can share more. Hello, how are you doing?
I'm fine, and you?
I'm well. Receive greetings from Kenya.
Thank you, and greetings from Cameroon too.
Oh, we received the greetings. So I'd
Yeah.
like to ask you to kindly introduce yourself and what you do.
My name is Ngo Abdullahi Banfogha, and I'm the founder and director of Hope for a Better Future. I'm also a country representative for Masterpiece Cameroon and International City of Peace Cameroon Club. Yeah. So we have been active with
And
developmental
uh-huh.
projects, yeah, in Cameroon, like water and sanitation, women empowerment, uh, women empowerment, agriculture, environmental issues, and other positive programs that bring positive impact to our community.
Okay. So
Yeah.
I'd like to ask about the COVID-19 situation in your country. Kindly share statistics on the COVID-19 situation in Cameroon.
Yeah, the situation I can describe at my level as I can describe as bad. We started with two cases on 19th of March, and right now, yesterday, the 9th of April, we were at 730 confirmed cases, as confirmed by the Ministry of Public Health. We had 10 confirmed deaths and 60 recovered. Yeah, so we are still waiting for statistics for today, but so far the Ministry of Public Health have posted some information about uh, on 47 people that went for that were in intense care. 37 has recovered, and the others are still in they are still observing the others. So far we can say it's good news for today. So we'll keep hoping and following the step of the World Health Organization and the Ministry of Public Health.
All right. So I'd like to ask you, like, how are you coping at the moment with this situation? Is Cameroon on quarantine or is it on lockdown? What is the situation in Cameroon?
No, Cameroon is not on lockdown, but there are measures that are being taken by the government, like shutting down schools, limiting intercity travel, because you need to give a very good reason to travel. And just yesterday, they make it obligatory for people visiting public offices to wear masks. And the government has also put in place some plans for implementation. And we are hoping for more measures because so far, due to the closing down of schools, many are being moved from cities to villages. And though in some places, there measures have been put in place to check the temperature of people that are going in. But like we both know, uh, the temperature can only confirm for people who are intense. So somebody can still be positive, and the thermometer cannot dictate. So it's really a sad situation, especially people in rural areas. They are more vulnerable now. And Cameroon too, if like you already know, was in crisis, the northwest and southwest. So we were putting plans together to respond to humanitarian to provide humanitarian aid to people that were internally displaced. And this coming now to is like coming to add another weight to it, what we already had.
All right. So I just wanted to know, has your country closed the borders? Can you hear me?
You mean borders?
Yeah, the borders.
Yes, borders were closed some weeks back, and persons that are coming into the country are being quarantined for 14 days uh, uh, and observed for some moment and test before allowing them to go to their families. But we have had some sad cases of people that are escaping quarantine and moving into villages and some other places. So, and though the government has been trying to tighten the security of some of those places, like we heard in the news, that information so far, like I can say, is limited. Yeah, like people. Like in the northwest, for example, most places like there's usually power cut down. Like right now, we don't have light, so passing down information to people right down to some villages, like where my mom is in Donga Mantung. At times they go for a week without electricity. So those people, you can imagine if they have a case now and they need to report and their communication devices are off, how they are going to cope is really very difficult.
Allow me to ask, like, what is causing like now the power outages right now, or is it something that is normal?
Um, it was, I can say that it was kind of better sometimes back, and it's worse now. It was worse before the outbreak though, and the company in charge in New has they release communiques and they are rationing light. They give a timetable like these people have for this time, these other people have for this time, and stuff like that. But most of the time, the timetable is not respected. Most of the time, you just see power just go off unannounced.
Okay. I'd like to ask, um, could you kindly maybe share like for the internally displaced persons,
Yes.
all right?
Mhm.
Um, what action is being taken by the government in
Uh,
taking care of
they go.
them?
Yeah, I think more action is the government is trying at its end. They did their own assessment, and they have been responding with some food items, and with the crisis still ongoing, and it's a fight between the government and the separatists, and the government has offered separatists that want to drop down arms. When you drop down arms, they kind of integrate you and offer some vocational training to you and settle you uh, and stuff like that. But as I can say, it's getting worse. It's not getting better. So, but more action is taken by the NGOs and the UN wings. All the UN wings are here. The UN OCHA, the UN UNDP, and others. So they have been they have funded the first UNDP funded the first recovery grant, I think, some time back, and we were to resume the second cycle this March before the outbreak. So they are now like switching from the humanitarian crisis, and they are now analyzing the situation for the COVID-19. So it will really be a tough one for persons for displaced person because. Uh, the government is putting on further measures, and it seems maybe some it will be they are limiting door-to-door campaign. Yeah, which means delivering food items or training to them would be really difficult. So we keep praying and hoping that the situation get better.
All right. So I have another question for you. You mentioned earlier that. Okay, let me first start by asking, like,
Yes.
when was the first case of COVID-19 reported in Cameroon?
Yeah, the first two was reported in March 19,
Okay,
March 19,
March 19th.
2020.
And
Yes,
all right, and
the
I had
first
you
two
mention
cases.
that. Okay, and I
Yes.
had you mention that your president has not yet addressed the public since the first case was announced. Can you elaborate further on this?
Yes, there have been called and online campaigns for him to address, but the government keeps saying that he's the one giving instruction to the prime ministers to take most of the action. So I believe maybe they still have a plan for him to address. Though it doesn't kind of sound right for me because I can say he's the only president that has not addressed the nation yet. We are hoping that he does because this is really a serious issue and people are looking up to him now more than ever. So we, like I said, Cameroon already had more issue with the humanitarian crisis. So this is coming to add more. So I believe the Cameroonians are really looking up to him to address the nation now. So the earlier he does that, the better, because there are fake news circulating around and people are really in depressed moment. Some believe that the COVID-19 is just some politics word, and there are some that still believe that they can cure it by drinking more alcohol. So there are a lot of things. So I believe that more action is needed by the government, especially now that they are limiting other people to respond. I think more action is needed by the government, especially at the door, at the community based level in villages and other and intelligent and for the internally displaced person.
Okay. You mentioned earlier that 700 and there have been 730 confirmed cases. So I wanted
Yes.
to ask, like, does your country have the protective gear that should be used by the health workers, and are masks are also available for use by the public? And are you using the use of sanitizers being utilized in the awareness campaign?
Yes. Yeah. All the campaigns are following the World Health Organization guide, and the mass situation. Due to that, the circulation of information in other countries of some masses testing positive, many people are skeptical of using already made masks. So a lot of people are doing their own homemade masks now. So the government, like I said, already make it obligatory that going to any public institution, like you must wear a mask or you will not be attended to. So, which that action will resume from Monday, this Monday, coming Monday. So, masks it will really be needed, especially. And the issue too is the right mask because people are just doing anything. There are just some that they just believe there are people that wear masks for a week without sterilizing. So it's really, like I said, we really need awareness, especially at the community level, down at the community level.
Okay.
Yeah, yeah.
Okay. Is relief food being provided
Not
by
at the
the
moment.
government to the nationals?
Not at the moment. Unless they still have a plan, nothing has been done as such yet.
Ah,
Yeah.
okay. So, like, the other thing I'd also like to ask is are there maybe doctors who have died as a result of COVID-19 being infected while on
No.
course of duty?
Like I said, Cameroon is more careful, like especially with the identity of persons that test positive. they don't release the identity of people that are testing positive or people who died. So it will be difficult to have that information of who died, who is positive and stuff like that. Except that somebody really decide on his own to say that I have COVID-19. So if it's information coming from the government, they're only dealing with numbers, so they're not calling names.
Okay. And you have stated like 40 people have so far recovered in your country from COVID-19. So,
Yes,
what do you think is,
that was day before
pardon?
yesterday. That was day before
Uh-huh.
yesterday, but today's
Uh-huh.
statistics, now just like more people have been recovered, which is 37 more. So adding to 33 more, yeah. Adding to to the 60 already, that means we have 3.
Oh, okay. And your government has stated that they will stop announcing the number of confirmed cases. Why do you think this is the case?
The reason is that the information is sensitive and it's causing so much panic, which on the contrary for me, I don't think that is the right thing. I believe that people at this moment really needs to know the right figure and there need to be transparency in this in reporting the case. I don't think keeping the numbers from the public is really the right thing to do. But from the reason they are saying it's sensitive information, the thing is causing more panic and they are going to report more of cases of cured cases and number of death and number of persons in intense care. Yeah.
Okay, so there's a bit of darkness where you are.
Yeah, I don't know
Maybe you
if you
can maybe
can.
put on the lights. I know you said that.
Yes, a moment, please. Let me.
Yeah, I know that you said that there's no light over there. Yeah, so viewer,
Yeah.
kindly bear with us. Yeah, he's going to. There are no lights in Cameroon, so that's why he's using
Uh,
a generator.
yeah, I
Using
think I should
generator at the
turn.
moment.
Yeah, like this. Yeah.
Yeah, yeah,
hmm I think
yeah.
it's better.
That's better.
Oh.
So, so, Ban, you started an initiative in Cameroon to combat this COVID-19. Tell us more about your initiative and how it has borne fruit.
Our initiative was launched yeah, on the 8th of this month, and we are focusing more on the most vulnerable, displaced, female-headed families, because we believe they are more in need. Yeah. So our package, we want to provide wash kit, want to provide wash kit for them, want to provide food items, want to provide information on on the on the COVID-19, and we also want to provide FM radio on people that so will be affected families. So to 6 family target is to reach out to 100 in all the regions. So we are putting in place plans and working in partnership with our international partners, and funds too are some issues. So right now we are working with Goodwill ambassadors. We started an online fundraising campaign. We are hoping it goes well, so we keep and see how it goes.
Okay. Allow me to ask you so that your viewers also can hear. Like, what's the population of Cameroon at the moment?
Hello?
What's the
Can you hear
population
me?
of Cameroon at the moment? The population of Cameroon. Yeah.
Cameroon is estimated at 27 million persons.
Or
But
27
the
million persons.
last sense, yeah, we are estimated at, the last census was in 2000, so if we are looking at now, we cannot, we should be more than. Yeah.
Yeah, you're
Yes.
breaking off. You're breaking off. I don't know
And the
why
government so
the
far
internet
released
is not.
a billion francs in response to the cases. There have been donations from some people think that which were not seen. Be slow internet. Yeah, like I said, Cameroon is about 27 million persons, and the government released CFA to respond to the COVID-19. So they have been mixing. The amount is small. Looking at the weight of and the impact the COVID-19 is caused, and also looking at the amount they released to other which are not COVID-19. So 1 billion is small. So, and the government also opened an account, and some companies and well-wishers are donating to the crisis. So some politicians too already started an online donation, but the government is not that happy about it, and they ordered today that some of their accounts should be closed. They think that the action should be coordinated by the government, and people that want to stop it, the action should do that through the government.
All right. So I just want to know what kind of method has been used by your government now to disseminate COVID-19 information to now the 27 million? Are you using mass messaging like SMSs, or what are they using?
They are using the national TV, the CRTV, and they are also printing posters to yeah. But like I said, CRTV, due to the crisis, people were skeptical about CRTV, so more people don't watch the now. So people rely more on a private station. Most people were angry with the national station on poor reporting of the Anglophone crisis. So, on my opinion, they should into community. Shorted CC or radios are not on, so I think they should a community-based awareness in which uh, because pasting info, especially all mothers in the village, they cannot read. So there should be a way of communication, especially in a local and pidgin language, which is the most the common used and the liked. So more information. They focus on TV, the CRTV, which I believe is not reaching out. Yeah, because working at the community and looking at the response, like we moved around yesterday, people are really, they just know that something is existing as COVID-19, but they have no little
Wow.
information about it. So and they don't take and they were
Wow.
advised of the if you want to be going out to the person should make sure you don't hawk your children before you get into the house. You make sure you move straight to the bath, remove your clothes, soak them in soap. Maybe take a bath if possible before coming to in contact with your children. Yeah.
Wow. So so like with what you've stated, it seems like there's lack of information for for the citizens, and
Yeah, we cannot.
indeed this is a huge cause of alarm.
Yes, we cannot say lack completely because there is information. It's limited actually. The word should be limited information. Yeah, because actually they are trying to inform through the national TV, but like I said, people don't watch more of the national TV, especially in the north and in the northwest and southwest of Cameroon. Yeah, people watch more of private radios and uh, and TVs. Yeah. So and with
Okay.
the constant cut of
Okay.
electricity, there's need of going beyond radios and TVs. Yeah, there's need of maybe using town
Mm,
criers and moving door to door,
mm,
developing a strategy. Though some are saying that door to door is not advisable for you might spread the virus. But I think at this moment, uh, looking at the level, some families are really ignorant. So I think there should be a way. So we should develop a more protective way of getting to door without actually getting in contact with the people you are passing the message to. So, like the
okay.
message we're passing, we make sure we practice the social distance. Yeah, when we go, we make sure that people come, they stand in the line, better from one another, and we stand very far from people and we pass the message and we deliver the wash kit and the other packages that goes along with our humanitarian gift, and we move to the next family.
Okay. So I'd like to ask, how is the healthcare system in Cameroon?
Cameroon don't have the best of health system, especially in rural communities. Uh, um, I work more in rural communities, so it really would be a very big problem if we are hit hard. If we are hit hard like some countries like the USA and Italy, it would be dangerous this way because the hackers are really they are really backward. And though in the government response plan, they have plans that they are going to install isolation centers in all the regions. That is the capital cities, which means people in subdivisions will be transported to capital city if they are tested positive. So that still is a will be a big problem if the virus goes deep.
Okay. So are they using the local language pidgin uh for communication, or they're using English, or what are they using?
Yeah, person using pidgin and local languages, mostly NGOs and well wishers. Yeah, like people like groups, CBOs, community-based organization, and others. So, but the government so far, yeah, though there are some SGOs that move around markets and they speak in pidgin. Yeah, but I think the pidgin is kind of limited and it's limited. So they focus more with French and English, which are the two official languages. And uh, I think in my end, I think that people that can understand French and English already have the information. So the people that really need the information now are people that really don't understand these languages. So there's need for more programs to be done in local languages and in pidgin to ensure that the information gets right down to the most vulnerable.
And for those ones who are infected, has the government put isolation centers in the different in different maybe cities or towns?
A new isolation centers was announced that is under construction in Douala, but so far those in Yaoundé they are using some hospitals, and they are using this this these houses that they got to these low cost houses that they built in somewhere in Yaoundé at Olembe. So they moved most of the persons that came into the country. Most of them are being diverted to these centers, and they observe a 14 days quarantine before they are allowed to go see their families. Yeah, but recently, yesterday, it was announced that the isolation centers will be constructed in all the capital cities. Yeah, which means there will be 10 isolation centers. So we are still hoping to see that into reality.
Now, what is your message to the government? Do you think what do you think the government should do urgently?
Yes, I think we have delayed, and I think if there's something to be done, it should be done now. I think they are taking too long to take a decision on this and the virus. From what I read, except that I'm not reading well, one single person can infect an entire nation, and it goes within a short while. So, taking weeks to take these decisions and taking another weeks to implement them is really putting people in risk. So I think they should act now and fast, and I think they should also be transparent in information, and they should also allow NGOs and other political parties to respond. They should write a training if they think people to respond.
Okay. But your internet is breaking, so we can't. We've not really heard what you said with the last question. Could you kindly repeat? Like, what do you
Yeah,
want
what
the
I'm saying
government
is
to? Yeah.
yeah, what I'm saying is if I should have a message for the government now, I should
Yeah.
say that they should try as much
And be
as
specific. What
possible.
do you want them to do?
Yeah, they should be transparent in giving information. Like they should not think that this is a pandemic and a very serious case, and I don't think keeping the number of cases is going to help in any way. I think they should be transparent with the number of cases, and I think they should allow NGOs and other political parties and other well wishers who intend to be in the front line fight to to respond in their own way. Yeah, because the fight, I think politics and every other thing should be kept aside, and people should not be stopped to implement. Yeah, there could be a control measure. If they think that people are not going to respond rightly, they should train people on how to respond. But I don't think that NGOs are that ignorant. I think they know what to do, because we attend a cluster meeting and we are being trained on how to respond. So they should allow us do our job, and in the best way we can do, and they should also support our initiatives. And in terms of action, which is the most important, they are taking too long to take decisions. Yeah, this is a virus that is too serious. From what I learned about it, one single person can infect an entire nation. So taking weeks to plan on how to plan to release communiques and taking another weeks to implement is really taking long. So I think they should act now and fast. Yeah, building isolation centers. I don't think it required that long. I think looking at what other countries are doing, yeah, China was able to build one in 9 days. Yeah, so I know we don't have the capacities, but at least we should be able to build one in less than 2 weeks.
Wow. So, like, let's say for example, like the pregnant mothers and those who have just given birth. So, how is the government taking care of them, ensuring that they are protected from COVID-19, and whether they access ANC visits?
Yes, like I said, those that pregnant women and other people going to other hospital are still at very high risks. But because like I said, there are no isolation centers in close by, like in the northwest, for example. Yeah, so they are using some hospitals and some nurses. I did a small survey to ask some nurses in rural communities if they have been trained on on how to receive patients and stuff like that. So from the response, I guess most of them are just following the public line. So they take to make their own masks and wear their own masks and stuff like that. So if somebody is going to the hospital, it will still be risk. So building isolation centers is really something that should be urgent now because hospitals and doctors are at risk, and people going to the hospital are also at risk.
Okay. You mentioned earlier that your government is against fundraising towards
Sorry?
COVID-19. Haven't they said, you mentioned earlier that your government is against fundraising for
Yes, yes,
COVID-19.
they
So
are.
does this
Yes,
mean that your government has not yet set up an official fund where people can donate to? Hello, Ba.
they created a fund, like they released a billion. Are you there?
Yes, yes, I
Said,
can hear you.
and they also for people to some political parties are more popular, so they started their own fundraising and they are raising more than and the government is not happy
Mm.
about it. And yeah, so the government
Why?
want
Why
that
is it not
people
happy?
should. I don't know. They just want to be at the lead. So they ordered that account that are created in banks in respect to raising funds for COVID-19 should be closed. So it's really a sad situation. I don't how they using politics to play with people's lives. So
Oh my.
it's a sad situation.
So how are you dealing on a personal level with this situation, especially with the
Uh,
psychologically?
uh, I can say I'm scared and somehow motivated because I know more is being needed from me, especially people that look up to my organization. So all I can do is use preventive measures. Like in my house, for example, we got a wash can. A tap bucket outside. You must wash your hands, sterilize your hands before you ring the doorbell, and we limit the number of times we go out to get food, and uh, we have just my wife and I, for example, that goes out. All the children they stay at home, so we try at most as possible to ensure that we stay safe.
Okay. So the other thing I'd like to ask you is, lastly, are you collaborating with other NGOs, or are other NGOs, CBOs collaborating with each other to fight this pandemic?
Yes, yes, certainly. Like I said, there were already plans to respond to the humanitarian crisis, and we have been attending a cluster meeting under the coordination of the UN OCHA. So most of those meetings, though, we do them now online through Zoom calls and stuff like that. So we are analyzing the
You're kind of breaking up.
and
So, Ba,
develop.
your internet is kind of
Hello.
your internet. I'm saying your internet is kind of slow.
Yeah, it's breaking a bit.
Yeah,
Yeah.
there's something you were saying before you broke off. What were you
Can you
saying? Yeah,
can
I
you
was
ask the
asking.
question again, please?
Yeah, like what are you doing together with other CBOs or NGOs to fight this pandemic? And have you brought in the private sector as well?
Yes, like I said, the UN OCHA was coordinating the humanitarian response plan, and there are different clusters, like the WASH clusters, the the the, the WASH cluster. We have the health cluster, we have the protective clusters and other clusters. So we have been having meetings and plans on how to respond. So the plan was to resume this March, but due to the outbreak, they are now switching and analyzing on how to continue with the plan, and also putting in mind and giving more priority with awareness creation and watch activities. Yeah, so we are having Zoom calls every Friday with the UN OCHA and other clusters. So other NGOs who are also responding. So I can say there's a kind of a meeting point in which we meet to develop a strategy, implement.
Okay. So, lastly, what is your message to African youth at this particular moment, and also the youth in Cameroon as well?
My general message is for persons to practice to protect themselves. They should follow the advice from the World Health Organization. They should they should practice personal hygiene. They should wash their hands as many times as possible. And most importantly, they should be responsible enough. Yeah. Stop going out to drink and stop thinking that this is a political issue. This is real, and stop thinking that it's killing on the white. It's also killing blacks. A lot more blacks are dying in the USA than white. So this thing is really serious, and we should take.
Okay, all right. And if lastly, if you are given a sit down with the president and the prime minister, what message do you have for them if they invited you to State House?
The message will still be the same, especially for this pandemic. They should keep politics aside, call every Cameroon together, and develop and implement a strategy, and allow everybody that wants to help in its own way. They should guide
Okay,
people on how to help. They should not insist that the funds must pass through them, because a lot of people don't trust the government, and there are people that trust more of NGOs. And I believe that to respond, it doesn't mean that you must go yourself. You can still send somebody like an NGO to implement. So they should be transparent too with the information and keep politics aside.
Okay. So thanks,
Yeah.
thanks, Ban, for joining us, and
Yeah.
continue doing the incredible work you're doing in Cameroon, and be safe and keep your family safe. So thank you for joining us on this live talk show, where now you've
Yeah.
shared
Thank you too.
what is happening in
Yeah.
Cameroon. So I really appreciate. And anyone who's also going to listen in to this broadcast, would like to tell you that we are going now to hold more sessions where we are going to bring youth from various parts of the world, so that they can share their perspectives with regard to COVID-19, and also even youth from Africa as well. So thank you for sparing your time. I know that there was blackout today and you are using generator. I just want to
Yeah.
appreciate you for sparing your time and resources to join us. Asante sana.
Yeah.
In Swahili here we say asante sana.
Thank you. Thank you. Yeah. Berio in Lamso. It means thank you. Yeah.
Oh
Thank you for
yes,
having
yes.
me.
All right,
Yeah.
Sawa. Thank you so much.
Yeah.
And
Yeah.
pass
You're
my
welcome.
love to your family.
Yeah, they are going to get there. Thank you.
Okay, thank you. All right, viewer, you've heard it. And if you've not yet subscribed to this channel, kindly go ahead and subscribe, so that you may get more notifications on new video uploads and also new live shows that we'll be hosting. Thank you once again. Cheers and enjoy your evening.